there, welcome to our channel. I'm Dr. Alyssa Easley from West Pelvic Wellness, where we take a holistic approach to pelvic floor rehab. On this channel, we are going to be sharing tips, exercises, and strategies to help you feel your best. So don't forget to subscribe and follow along for all of our content, and check us out on all our other social media platforms. I am going to show you a hip hinge, also known as a deadlift. Now, this is an awesome postpartum strength move. You are going to be targeting your hamstrings, your glutes, your pelvic floor and core, and your postural support system. I love this move because moms bend over a lot to pick up their babies, put their babies in the crib. So this is going to be a really functional exercise for you to practice and get down. I am using a kettlebell today. You can use dumbbells. You could grab a water bottle or an item that's a little heavier if you don't have a lot of equipment at home, or you could hold your baby. Hug the baby at the chest while you do this one. So first thing I want you to know about form is that when we do a hip hinge, we are not going to bend our knees like we would with a squat. Our knees are going to stay soft. We are going to plant our feet into the floor so that there is weight in our toes and our heels. And we are going to think about bringing our sit bones behind our body with a flat spine. I do not want you reaching with your lower back, and I don't want you pulling down with your upper back to get the weight to the floor. The weight is going to drop to the floor as you do this hinge. You don't have to worry about the weight itself. It's more about where those sit bones are going. So feet are planted. My back is nice and flat, or as flat as it can go, because you might still feel a little arched in this postpartum season, and that's okay. I am going to squeeze my lats, which is a muscle in your armpit and your back. So activate those lats almost like you're squeezing your armpits into your chest. Bring your bottom behind you, knees soften up, stand up to stacked posture. So rib cage is straight forward, belly button is in line with my rib cage and my pelvis instead of belly button leading us. So once again, if you need extra help with your form, I want you to use a wall. So put yourself in front of a wall, and you're going to reach your bum back to the wall. When you find the wall with your sit bones, stand up tall. Now, if you have the baby as your weight, you're holding the baby at your chest, going down, standing up. It's very gentle. It can be really fun, depending on how old your baby is. So if you are not having any back pain, any glute or sacrum pain, then you can add single leg strength movements at this stage. Let's try an RDL, and let's try a split squat. For your RDL, one leg remains on the floor, the other leg goes behind you as your chest comes down. You can do this without a weight or with a weight. Weight is more challenging. I'm going to hold the weight in the opposite hand of the hip that is holding me up. This is also a good one to work on balance, which can feel kind of wobbly postpartum. So take your time. If you feel like you're losing your balance, go nice and slow. So my back is going to stay flat. Foot lifts behind me as the weight comes down. Stand up to stacked posture. A split squat, we're going to take a step. You could use a chair at home or your couch or your bed, but you're going to elevate one foot slightly behind you, and then you're going to get yourself far enough away from your step to complete the movement, but you're going to sink into that back knee, stand up tall. Sink, stand up tall. You should feel the working legs quads, the front thigh muscles, and the side hip area. This is a really good one, really challenging too. So if I'm going to hold a weight, it's either in front or in the opposite hand.